Welcome to Sunshine Science. Our mission is to alert the public on the dangers of insufficient sun exposure to your health. America's second largest public health problem is insufficient sun exposure. It's responsible for 340,000 preventable deaths per year. Adequate sunshine should be incorporated into daily routines in order to become healthier and increase life expectancy. That's why the Sunshine Health Foundation is committed to alleviating this severe health problem. Our world-renowned scientists provide public health officials with research on the benefits and risks of sun exposure. If you're ready to build healthier communities, then let's get started.
Are you a Black American woman who's pregnant or planning to become pregnant? If so, this episode of Sunshine Science is for you. One of my favorite cousins, Tiffany, just had a baby, a beautiful baby girl named Maya. When she was pregnant, Tiffany would complain about how whenever someone found out she was pregnant, more often than not, they'd immediately start to offer advice, information, their opinions on the latest science on all things pregnancy and child rearing, whether it had been asked for or not. And while it's been a long time since I've been pregnant, I do remember that feeling of getting bombarded with unsolicited advice and data on how to have a healthy pregnancy, what to eat and not eat, what to do and not do. So I'm particularly sensitive to the mother's overwhelm when it comes to advice and information and data. But what if getting sensible sun exposure could help reduce your risk of preventable, unnecessary pregnancy risks? If daily sun exposure could help prevent negative, chronic, and mental health impacts on the health of your child, wouldn't you want to hear all about that science? I know I would. And modern science shows us this is absolutely true. Studies show that insufficient sun exposure impacts pregnancy in myriad ways and can have devastating impacts on the health of your child, including long-term chronic and mental health impacts. This episode of Sunshine Science is dedicated to exploring some examples. And along the way, I'll share information linking insufficient sun exposure to increased risks for diabetes, multiple sclerosis, and asthma in our children. As we explore these issues, it's my hope that you're empowered to consider ways to ensure you're getting sensible sun exposure for your health and that of your baby. Do you remember Allyson Felix? She's an amazing U.S. athlete who broke Usain Bolt's world record by winning her 12th gold medal at the World Athletics Championships in 2019. And she's the only track and field star to win 7 Olympic golds. She's also a mother, a Black American mother. And on May 16, 2019, she used her voice and her platform to testify to a U.S. House of Representatives committee holding hearings on racial disparities in maternal mortality. In her testimony, she told the committee of her terrifying experiences coming near to death during the birth of her daughter. She told the committee that she was shocked to learn that in the 21st century in America, women are still dying from childbirth. The fact is, Allyson Felix could have easily lost her life and that of her baby as a Black woman based on irrefutable statistics regarding Black maternal and infant health in this country. Not only are Black American women 3 times as likely to die from childbirth as white women, but our infant health outcomes are disproportionately negative as well. Now, I've been studying and working on issues related to health disparities for my entire career in public health. And when you consider just about any public health issue, you will find striking disparities based on race. The COVID-19 pandemic, coupled with the growing racial justice movement in this country, have highlighted these long-standing health disparities for Black Americans, including disparities in maternal and infant health, those issues that Allyson Felix spoke to in that hearing. Despite continued advances in healthcare, rates of maternal mortality and morbidity and preterm birth in this country have risen. And Black Americans continue to be at increased risks for poor maternal and infant health outcomes. In some instances, these disparities are the result of barriers to care for Black Americans. For example, there's research that shows that healthcare coverage before, during, and after pregnancy facilitates critical access to care that supports healthy pregnancies, as well as positive maternal and infant outcomes after childbirth. But we know Black Americans are more likely to be uninsured. Beyond health coverage, Black Americans face other increased barriers to care, including limited access to providers and limited access to hospitals, and lack of access to culturally appropriate, unbiased care. That insufficient sun exposure has also been shown to contribute significantly to these disparities. Let's dive into the science, the sunshine science. Did you know that insufficient sun exposure of pregnant women increases the risk of severe lower respiratory tract viral infection in offspring in the first year of life by 500%? Yes, 500%. Studies show that insufficient sun exposure increases the likelihood of poor lung development and respiratory infections in infants and in toddlers. And it also decreases production of vital antimicrobial peptides in infants. When it comes to preterm birth, insufficient sun exposure has also been found to increase risk by 132%. And the racial health disparities here are glaring. Not only is the preterm birth rate for Black Americans 64% higher than white Americans, but Black Americans have 2.3 times the infant mortality rate of white Americans. Black American infants are 3.8 times more likely to die from complications related to low birth weight as compared to white infants. And it doesn't end there. Insufficient sun exposure of pregnant women has been shown to increase the risk that newborns will die from sudden infant death syndrome, SIDS, in infancy or in early childhood. And we know that SIDS rates in Black American children are more than twice those of white American children. Sun exposure also impacts preeclampsia. Preeclampsia is a potentially life-threatening, persistent, high blood pressure that develops during pregnancy and the postpartum period, and it disproportionately impacts Black women. In her testimony to the House, Allyson Felix tells the story of how she developed preeclampsia at 32 weeks, and that preeclampsia led to an emergency cesarean. Her daughter spent almost 1 month in NICU recovering. What if sensible sun exposure could have helped? Studies show that insufficient sun exposure in women in the first 26 weeks of pregnancy increases the risk of preeclampsia by 54%. There's even recent science showing that preeclampsia in mothers resulting from insufficient sun exposure can lead to high blood pressure in their children. Studies have found that insufficient sun exposure of pregnant women also increases the risk of childhood obesity and multiple sclerosis in offspring. There's also an association between insufficient sun exposure during pregnancy and an increased risk that the child will have asthma. And when it comes to Black Americans, asthma is of particular concern because studies show that our children are 5 times more likely to be admitted to the hospital for asthma as compared to their white counterparts. To add to that, in 2019, researchers found that Black children were 8 times more likely to die of asthma than their white counterparts. And there are also significant mental health impacts of insufficient sun exposure. Not only does it adversely affect the brain development of a fetus, but insufficient sun exposure is also associated with poor mental development, so much so that the chances of the infant developing an IQ of 110 are decreased by 50%. When it comes to autism, and insufficient sun exposure of pregnant women is also associated with an increased risk of having an autistic child by 142%. And this matters for Black American health because study after study indicate that Black children are more at risk for autism. Insufficient sun exposure of pregnant women has also been shown to increase the risk of her child developing schizophrenia by 44%. And racial health disparities are at play here too. In a 2018 analysis of data from 52 different studies, researchers found that Black Americans are 2.4 times more likely to be diagnosed with schizophrenia than white Americans. My advice to my cousin Tiffany and my approach to information and advice when I was pregnant 28 years ago was to 1, listen with an open mind, 2, do my own research, and 3, follow my gut. And that is my advice, perhaps unsolicited, to you. This episode of Sunshine Science is meant to empower you, to give you knowledge that you might not get anywhere else, knowledge that will allow you to make healthier choices for yourself and your growing family, and to inspire you to consider ways to get more sun in a safe, sensible way during your pregnancy. A safe, sensible way.
Thank you for listening to today's episode. If you're ready to build healthier communities, please visit sunshinehealthfoundation.org to find the latest research on the health benefits and risks of sun exposure. Or you can subscribe to our newsletter for our latest updates. Step out of the dark and embrace sunshine. Let's build healthier communities.